All right, welcome everyone to Connect+Government. We are so happy to have you here with us today. We try to always start these sessions off with a song that's related to the theme. And today we're going to be talking about a revolution of social connection initiatives in government. So we're excited to have you here today. So my name is Kasley Killam. I'm the founder of Social Health Labs, where our mission is to catalyze innovative approaches to social well-being. And I'm joined today by my co-lead on this series, Eddie Garcia.
Hi, everyone. It's great to have you all. My name is Eddie Garcia. I'm the executive director of the Foundation for Social Connection, where we are dedicated to promoting evidence-based initiatives to reduce social isolation and loneliness. And before we jump in to our programming today, we'd love to run through just a few housekeeping items. So first up, please note that we are recording this conversation, and we'll make that recording available to everyone after this session. Feel free to use the chat box to connect, ask questions, and share your thoughts throughout the programming. For those interested in transcript services, please note the live transcript item on the menu bar and choose Show Subtitles or View Full Transcript per your preference. Then lastly, please know that this series is centered around inclusivity, kindness, and respect. And we ask that everyone be mindful of these themes when engaging in today's discussion between yourselves and with the panelists. For the agenda, we will spend the first hour giving a brief introduction, hearing from our expert panelists, and then engaging in an open Q&A. Then for those of you who would like to participate, we'll stay on for another half hour for breakouts into smaller groups for discussion and connection. Now I'll turn it back to Kasley for a brief introduction of our Connect+Conversation series.
Great, thank you. And as well, while we're introducing today's session, feel free to introduce yourself in the chat. Where are you joining from today? Perhaps what organization you represent. We'd love for everyone to get to know each other a little bit. So if this is your first time joining the Connect+Conversation series, welcome. The goal of this series is to really generate ideas and share insights about how to address widespread social isolation and loneliness and improve people's social well-being through different sectors. So as you can see here, we've explored this topic through workplaces, cities, schools, healthcare, and so on. If you missed any of these past sessions, you are welcome to watch the recordings on our website. I think we will put a link in the chat with that. So today, in particular, we are going to be focusing on the government's role in addressing isolation and loneliness as a public health issue, since this is known to influence outcomes such as depression, heart disease, and mortality. As you may know, back in 2018, the UK appointed a minister for loneliness, and earlier this year, Japan followed suit. So this is one of the ways that governments in different countries have responded to high rates of loneliness in recent years, but it's not the only way. And especially in the past year with the pandemic, we've seen new innovation in legislation and funding and other government initiatives recognizing and addressing this issue. So today we're going to be talking to experts at global, national, and local levels to really understand what's underway and what's in store in the future. So before we introduce today's speakers, we're going to do a quick poll. We would love to hear from you. Do you think that your country, wherever you're joining from today, US, Canada, or abroad, do you think your country should appoint a minister of loneliness or an equivalent type role? And if you have other thoughts on this that you'd like to elaborate on, feel free to put those in the chat as well. We're definitely curious to hear your opinions on this. So we'll give everyone a moment to respond to that, and then we will share the results. Okay, if you haven't responded and want to, go ahead and do so now, and then we will share. Okay, well, we can go ahead and release the results now. So it looks like 55% of you were a strong yes, and 38% said maybe, and perhaps you can decide after today's discussion. Perhaps it will inform you. I'm not sure if you are all able to see those results yet, but anyway, majority said yes, and a second majority said maybe. So very interesting. We'll see how that might change after today's discussion. Great. Well, now I'm going to hand it back over to Eddie to introduce our speakers.
Great. Thank you, Kathleen. Okay, so first up, we have Christopher Mickton, who is the technical officer at the World Health Organization in the Department of Social Determinants of Health, who is leading global initiatives on social isolation and loneliness among older adults and other populations. We're thrilled to have Chris come and speak about the wide variety of projects that the World Health Organization will be engaging in. So more to come there. So thank you, Chris, for joining us. We also have Kripa Sripada, who is a health policy advisor to Senator Tina Smith and has been actively involved in federal legislation that addresses social isolation and loneliness, including the authorization of the Older Americans Act and championing a variety of policies to help address this issue. Wonderful to have you, Kripa, and looking forward to the conversation with you as well. Finally, we have Sarah Needler, who is the Director of Research at the Council for State Governments and the Center of Innovation, and a co-lead of the recent report, Social Isolation and Loneliness, State Policies and Interventions. Excited to hear what Sarah has to say about the state level engagement and local level engagement, and more about the report that came out. Wonderful to have you as well, Sarah. And then from all of you, we're very interested in getting your questions as well, as Kathleen mentioned. So we definitely want to hear from you and give you a chance to interact with today's speakers. So please add your questions to the chat as they arise, and I will read them later on following the panel discussion. For now, though, I'll turn it back to Kathleen and to go through the questions with our panel.
Great. Thank you so much, Eddie. And thank you to all of our speakers for joining today. So we're going to kind of start at the global level and then zoom in more narrowly from there. So Chris, let's start with you. Obviously, the World Health Organization is not a government, but you work very closely with governments as well as senior officials from around the world. So tell us about the approach that you're taking at the WHO and how you're coordinating across those different government bodies.
Yeah, sure. Thank you. Thank you. And nice to be here and nice to meet you all today. So I'll answer this question, it's kind of a two-part question, but I'll answer both parts, our approach and the role of government, more or less at the same time. First, a word about WHO. Although it's not a governmental organization, it's basically run by governments. It's got 194 member states, that's 194 countries around the world, that's almost every country in the world, not quite, but almost, who sit on the World Health Assembly, and they basically make policy decisions and management decisions for WHO. So not a governmental, the organization of one single government, but it's the organization of many governments. WHO's only recently started addressing social connection, loneliness, social isolation. We haven't quite decided on which term we should use in future. And so we're still in the process of developing and finalizing our strategy. But our general approach is made of two broad components. One has to do with advocacy, awareness, and it really aims to increase the global political priority of social isolation and loneliness. And by global political priority, I mean the degree to which international and national political leaders actively give attention to this issue and back up that attention with financial, technical, and human resources that are commensurate with, that are in keeping with the severity of the issue. And that's really the aim of our first component, is increase this political priority globally. And we're exploring different options at the moment, how we might go about trying to increase this political priority at global level. And some of the options are, for example, setting up a high-level international commission with kind of quite well-known people that would kind of draw attention to the issue and increase awareness of the issue. Another option is, these aren't mutually exclusive, participate in various global campaigns addressing the issue. A third option is work towards the adoption of official resolutions, either in the World Health Assembly, that's the official governing body of WHO, or the UN General Assembly. And these resolutions are typically adopted by all member states, so 194 member states, and then they commit themselves to implementing them. So they have quite a bit of influence around the world. And yet another option is creating a network of member states or countries to spearhead these efforts. And we're trying to take the final decision on the option we'll choose at the moment. So we should have a decision within a few weeks. But regardless of which option we go with, governments will play a critical role in this. And if we go with a high-level commission, we'll want to have representation by governments. If for a World Health Assembly or UN General Assembly resolution, it's kind of by definition, they involve governments. And if we have a group of member states to spearhead efforts, again, governments will by definition be involved. So that's the first component, increasing the political priority of the issue at global level. The second component of this kind of overarching approach is they're focused on evidence and cost-effective interventions. And these two components of our strategy are very much independent. You can have as many cost-effective interventions as you want, but if the issue is not enough of a priority, they probably won't be scaled up to a degree that's the degree that's necessary. And conversely, even if the issue is considered a topmost global priority, if you don't have effective interventions, you're not going to be able to shift the problem. So really, these are two interdependent aspects. So in relation to the second component, we haven't worked out all the details, but what we've decided to do is more or less the following. First, try to build up what we're calling the evidence architecture for social isolation and loneliness. And the evidence architecture is kind of made up of two parts. One is first the collection, the distillation, the dissemination, especially to policymakers and decision makers, of high quality evidence, especially evidence on what works to address the issue. And these can be in the form of electronic portals, policy briefs, guidelines, etc. They can take different forms, these kind of evidence synthesis products. And the second part is to try to get the evidence really institutionalized in policy and in practice, including by government. We're also trying to develop what we're calling an intervention accelerator. I think there's a recognition that we don't really at the moment know which best interventions and which are the most cost-effective interventions. And the aim of this network would be to bring together intervention developers, evaluators, implementers to speed up the process of developing a suite of effective interventions. Some of the specific things we're doing at the moment in relation to the evidence is mapping all the evidence on social isolation and loneliness. And we're going to produce online evidence and gap maps, they're called. We're going to start on some official WHO guidelines on interventions. And these synthesize the evidence and they make very clear recommendations, mainly for ministries of health as to about what they should be doing to address this problem. And again, in this component, governments have a critical role to play. For example, in institutionalizing the use of evidence, some governments are already doing this, are having what they're called evidence-based budgets, which basically allocate money to programs only if the programs are evidence-based. And I think they do that in the States, in the UK, they do that to a certain extent, but not all over the world. And something else governments can do is through their national funding bodies, they can try to fund research in this area in a more kind of strategic and coordinated way to make sure that the gaps that are there are addressed as quickly as possible, including scaling the development and scaling up of interventions. So that's an overview of our approach and some of the roles government can play within it.
That's fantastic. Thank you so much, Chris. It is really exciting to hear about this, and all of the things that you mentioned are going to be such useful resources to all of us who work in this space. So very excited to hear about that. So now we're going to zoom in a little bit and kind of look at the national level here in the US, but hopefully that'll still be relevant to different countries around the world. So Kripa, let's move it over to you. You are a health policy advisor to Senator Tina Smith, and in that capacity, you've played a key role in federal legislation that seeks to address social isolation and loneliness. So for people who are joining who perhaps are not familiar at all with this kind of legislation or some of the other work that Tina Smith has done in this space, what bills have been introduced around social isolation and loneliness to date, and where do they stand today?
Great. Well, thank you so much for the question, and again for the invitation. It's really exciting to see so many people logged on to have this conversation. I find that very encouraging, and also really awesome to learn more from Chris about what the WHO is doing. So very happy to be here with you all. And I'm happy to talk more about the role of the senator and how she's been prioritizing social isolation. Just to zoom out a little bit, I do want to talk about, her specific strategic priorities and her values. She starts from the value that we should expand access to mental health care across the age continuum. And I think when we were looking at one of the key drivers of negative mental health outcomes, this issue of social isolation and loneliness frequently came up. She saw an opportunity to address this issue through the Older Americans Act, which is under the jurisdiction of the Senate Health Committee. So that's Health, Education, Labor, and Pensions. And she sits on that committee, so thought this could be a good opportunity to take a look at the Older Americans Act and see where there are opportunities to increase its focus and attention on this emerging public health issue. So she ended up introducing legislation called the Older Americans Social Isolation and Loneliness Prevention Act, which is a little bit of a mouthful. But the basic idea is to call for increased attention and awareness within the Older Americans Act. And I'm sure people are familiar, but just to talk a little bit about the Older Americans Act, it was enacted in 1965. Established the Administration on Aging, and supports a range of programs to help older adults stay healthy and independent. So Senator Smith's bill is intended to improve upon the Older Americans Act with a few revisions. So one would be to support screening for the prevention of social isolation and loneliness, and to coordinate supportive services and healthcare to address social isolation. The second is to increase the focus of the Assistant Secretary for Aging on social isolation and loneliness through long-term planning, intervening an interagency working group, and engaging with aging network stakeholders. And then the third is to allow states to pursue grant funding for projects that address social isolation and loneliness amongst older adults. We were really pleased to see several of these provisions actually enacted as part of the 2020 reauthorization of the Older Americans Act, which actually happened in March of 2020, which was, right around when the pandemic started. And then, of course, with the pandemic, I think we all saw higher rates of social isolation and loneliness amongst our nation's elders and everyone. And I think from our position, we felt that we needed to provide additional emergency support and funding to help older people continue to live alone in their own homes and communities, and make sure that their social connections were strengthened as much as possible. And so we introduced additional legislation to basically provide that infusion of emergency supplemental funding. So funding for home and community-based services, with the focus on activities to prevent and mitigate the negative health effects of social isolation, including through the purchase of technology, so allowing for that use, as well as funding to enhance outreach to older adults and provide technical assistance to help area agencies on aging and nutrition providers as they were trying to address this more prevalent issue. As well as additional funding to address the specific health effects of social isolation on minority aging populations. I think the senator really recognized that this is an emergency and thought everyone would see it that way. But it did take a lot of pushing to get that funding enacted and distributed out. We actually kept pushing for this to get included all of 2020, but it wasn't actually officially enacted until this past March of 2021 as part of the American Rescue Plan Act. So we're excited to see that funding starting to go out as well. And then the third thing I would just mention is the Buildback Better Act that we're working on right now, that we haven't enacted quite yet. But it would provide additional funding for national technical assistance centers to continue to address this issue amongst older adults. And we're hoping that that gets enacted as quickly as possible. But I think long term, I think we're going to have a conversation about implementation of these different funding streams, how to think through the national strategy on social isolation and loneliness, and also push for long-term funding that we know has been a critical lifeline during the pandemic.
Wonderful. Well, thank you so much, Kripa, for sharing that. And it's just really exciting to see this taken seriously at a national level and put dollars behind it. So thank you. Okay, now we're going to zoom in even more to more of the state level. And Sarah, thank you for joining. You recently were part of a report called Social Isolation and Loneliness, State Policies and Interventions for the Post-COVID Era, led by the Council of State Governments. And in the kind of research that you did in that process, what kinds of existing strategies, policies, interventions came up around this issue, and how are you seeing this being tackled by state governments today?
Great, thanks for that question, and excited to join you all today and talk about social isolation and loneliness policy from the state perspective. Just to give a little bit of context for those of you who might not be so familiar with the Council of State Governments, or CSG. We are a nonpartisan membership association that works with state leaders across all three branches of state government. We provide policy support, technical assistance, that type of work. And one of the projects that we recently just were working on is a project addressing mental health policy for states. And as part of this project, we actually had a policy advisory group. It consisted of 19 members. So we had state legislators from 6 states, as well as state executive branch representatives, health officials from 8 additional states, as well as subject matter experts in specific areas that we brought together to discuss the challenges and possible solutions to mental health policy in the states. We focused actually on 4 different subtopic areas. Social isolation and loneliness was one of them, but then we also dug a little deeper into maternal mental health insurance parity, and social determinants of health. So just wanted to mention that in case anyone's interested in the briefs or the work that we did on those topics. Also happy to connect with you after the webinar. But today I'll share some of the results that we came up with on the social isolation and loneliness. And we have a policy brief that was shared. We also really started to think about how can data be collected and how can we provide and conduct more research on social isolation and loneliness, as well as highlighting some case studies of policies and programs that have worked. So happy to share those as well after the webinar, or I can put it in the chat in a little bit. But to highlight some of the key findings from this project, I think the first thing that we really started to discuss around social isolation and loneliness were the key policy challenges that state leaders were facing. And a lot of these challenges are actually very similar to what Chris was speaking to. So it's interesting to see that even at different levels of government, we're kind of combating the same challenges. But those biggest challenges that came out was, one, not really having a common language for how to talk about social isolation and loneliness, not knowing what's the difference between the two, how do we determine how this is an issue. And then also, in addition to not having that terminology, also not having the tools to measure social isolation and loneliness. And then in addition to that is sort of the lack of research and evidence about what works, what's cost effective. Although there is some research out there, it's quite limited. So states find that a little bit of a struggle to know what policy or how to invest their resources in this area. And then a third challenge that I would like to share is that we also talked about the need for different interventions and different policies depending on the age groups or the different target populations. So knowing that policies or programs for older adults might be very different than ones when we're trying to focus on younger adults or students. So after we talked about those challenges, we then wanted to share examples of what states are doing and how we could potentially address social isolation through state policy. So a couple examples that we first started talking about were really just how do states put a focus on social isolation and loneliness. And a couple examples of how states have done that is in New Jersey. New Jersey actually passed a package of bills around the state's long-term care industry. And that one of those bills actually included a requirement that facilities institute policies that prevent social isolation of residents. So this is one of the first bills where we were actually starting to put a specific focus on social isolation. As well as in Ohio, and this is more focused on younger students. In Ohio, there's a bill that requires the Ohio Department of Education and Mental Health and Addiction Services to maintain a list of approved training programs for social inclusion. So those were the first examples that we saw, but then we also wanted to explore what are some of the future policy avenues. There are some states who have already passed legislation or implementing interventions that address some of these, but it's really still new and kind of future policy avenues in terms of what we're seeing. So we identified 6 of those, and I'll try to go through those relatively briefly with a few examples for each one. And the first avenue that we identified was social emotional learning curricula. So this is in schools having a curricula for staff and for teachers to be able to assess student mental well-being. So an example of this that we discussed with the mental health advisory group was a bill in Connecticut. And this bill created an assessment tool to screen students who are at risk of suicide. And other states have also implemented similar pilot programs to use social and emotional curricula or develop task forces as well to start thinking about how to develop that curricula or assessment guidelines. A second policy avenue for states is telehealth in schools. So we talked a lot about how school-based health centers were a super promising intervention even before the pandemic. So I think it was about 35% of adolescents actually received mental health services in school. So this is something we talked about, schools being a huge avenue for students in terms of receiving those mental health services, especially around social isolation and loneliness. And even with the pandemic, this kind of has given us an opportunity when students are now sometimes remote, that we can now utilize telehealth or remote options for continuing to provide those services to students who might be in need. A third policy avenue we discussed was geographically isolated professions. So these are individuals who might be working in really rural communities. One program in particular that we discussed was the Wisconsin Farmers Wellness Program. So this is a program in Wisconsin to provide mental health and with remote options to farmers working in rural areas. And I know this is something that several states have been thinking about, including in Kentucky, which is where I'm based, and with CSG. And then a fourth one is teacher training. So this is just making sure that teachers are trained on how to identify students who might be suffering from social isolation or loneliness, and then how to prevent crisis. So Colorado has a grant program that's for professional development around crisis and suicide prevention. A couple other examples are Illinois, which includes this in their teacher license renewal, as well as Texas. Their certification also includes mental health services as part of teacher certification. The fifth one, which is not unique to social isolation and loneliness, but definitely is impacted by it, is provider shortages. And this has really been amplified by the pandemic as well. So just needing individuals who understand social isolation and loneliness and how to act in response to that. So a couple examples that we highlighted were New Jersey, and they have a budget proposal that's included quite a bit of funding for psychiatric residency programs, as well as Washington, which requires health professionals to take a suicide prevention course every 6 years. So there are ways to kind of incentivize providers to enter into this field or just to better educate them. And then the last of the 6 policy avenues that we identified is a fun one that I did not think about before we started this project, but is robotic companion pets. So several states have actually invested funding. I know Alabama, Florida, and Michigan have actually committed federal funding from the CARES Act for robotic companions for socially isolated seniors and individuals with disabilities and also caregivers. So this is another policy intervention that states could consider. But I will keep it at that and happy to answer more questions later and pass it back to Kathleen.
Thank you so much, Sarah. That was fascinating. And it's really interesting to hear about the robotic pets. I'm sure everyone on this call has a lot of thoughts about that, but also interesting to see the intersection. We did a session on schools, we did a section on healthcare, and those were both themes that you brought up. So really great to hear that. So it seems like, taking this all into account, we're still very much in the early days of this work and of governments taking social isolation and loneliness seriously as a public health issue. And so I'm curious, projecting forward in the years to come, what are kind of the opportunities that you see as most promising, most potential for governments to really lead and support that can truly have an impact? What should be the focus of governments moving forward? And so Chris or Kripa, maybe we can go back to one of you to start.
Should I start? Okay. I think a big priority in this area is, I said there are these we have 2 components to our strategy, one to do with advocacy and the political priority, the other one with effectiveness. I think developing cost-effective interventions, like a suite of cost-effective interventions, is really a kind of a top priority, because you don't want to get into the situation where this issue gets quite a bit of attention, and that's kind of happening now in certain countries. You have ministers for loneliness. Not many other issues have ministers for that issue, right? So it's already got quite a lot of attention in certain countries, not all over the world. But you don't want to be in the situation where it gets all that awareness and there's not much you can realistically do to reduce the problem. And I think we run a slight risk of ending up in that situation if we don't also really focus on the development of effective and cost-effective interventions for all age groups, for different contexts, etc. And I think these interventions can't be too complex. If you have very complex interventions, they're less likely to be understood, less likely to be implemented, and they have to be cost-effective because there are opportunity costs involved in this. And I think the funders and the policymakers who take kind of a much more kind of colder, realistic look at it, we may say, well, very interesting topic, important problem, but I think we'll invest elsewhere where we can actually make a difference.
Yeah, I mean, I think I agree with that completely. From my perspective, at the federal level, I think making kind of the economic case for this is really critical to make sure that there's kind of bipartisan momentum and interest in this topic. I mean, what has been really helpful to us is to point toward the statistic and the data on how if you're talking about Medicare expenses for individuals who are socially isolated, it spends $134 per patient. Like that translates into real costs on taxpayers. And I think if you're able to make the connection between investing in upstream, I guess interventions to address these problems earlier on, then you'll get that bipartisan interest in trying to solve this issue. So I really think making the economic case is a huge opportunity we have. But also just thinking a little bit more about other opportunities. I think, Sarah, you had mentioned in the report, and it just reminded me, with COVID, we have seen the proliferation of utilization of telehealth. And I think, we want to make sure that we're maintaining that long term. So making sure like There's kind of the Medicare reimbursement and continued payment for telehealth long-term. Also deploying broadband and high-speed internet across the country is critical for that too. And making sure that this is something that will actually be accessed by everyone that we're concerned about when it comes to social isolation. So those are two key opportunities that come to mind.
Now I'll add something on here. I think completely agree with everything that's been said so far. And I think one opportunity, especially for state and local governments in pursuing some of these things, is to use American Rescue Plan Act funding for some of this. There is a lot of flexibility in how that funding can be used by the direct funding that's going to states and local governments. And so I think that's something that should be part of the conversation, is how can that funding be invested in some of these programs. Especially, I think one of the challenges that a lot of state leaders have right now is thinking about how to invest these funds in a way that's sustainable, considering it's one-time funding. And so I think there's really a lot of opportunities for state leaders to pilot new programs that they haven't tried before. So maybe trying to evaluate a new program that's addressing social isolation and loneliness. And I think there's a lot of opportunity in investing some of those resources. And if we do see that something's working or having an impact, then that might be something that would be a lot of evidence and justification for a state to continue investing funding into those programs long term.
Could I ask a question of Sarah, just based off of that? I'm curious, what are you hearing from states about what are they going to do once they run out of that funding, like for some of the, the programs they may have set up to try to address this issue?
I would say nobody has a good solution quite yet, but I think a lot of the consideration is just trying to think about how to test or set up infrastructure or systems, and so things that would then be sustainable throughout. As well as just trying to think of things that where there might be an increased need during the pandemic and maybe things would be not so necessary afterwards. But I think this is something that states are still figuring out.
Well, perhaps Chris's work at the global level can help trickle down and help with that problem. So another question I'd like to ask is, I'm curious about all the people on the call today and others who are interested in this topic. What are the ways that the different stakeholders, whether they're researchers, practitioners, citizens, policymakers, how can we support these efforts? Is that through advocacy, or what does that look like? What can people actually do to help move this work along? And anyone feel free to jump in, and if you want to just choose one of those stakeholders, such as researchers or citizens, open to that.
Sure, I can jump in. I think kind of building off of what I was highlighting earlier, if we want to make that economic case, I think research into how these interventions can actually save money long term is really important. I think if we're able to show how $1 like global, federal, state investment is not wasted, but actually has long-term implications in terms of mental health and physical health outcomes, I think that will continue to be really critical, as well as something to think about. And I think Sarah was really talking about this is having those case studies and maybe those pilot programs in states and localities that really show like this is what happens when you do make these targeted investments and strategies to address social isolation and loneliness in different populations. I think that's just helpful for us to make the case, at the state level, national level, global level.
Chris or Sarah, do you have thoughts?
Yeah, I think, some of the things we're already doing, we have to continue to do, because I think sometimes when you're involved in an issue, you think everybody knows and is aware. And in fact, it's only a small minority of the population who probably knows anything about the connection between social isolation and its health consequences, for example. So I think, keep repeating that in different forms, et cetera. And one possible way of doing this is having kind of indices. You have, well, at the international level, you have like the Human Development Index, you have these different indexes. And they get a lot of attention. They get a lot of media attention. Countries compare each other. States, I guess in the States, could compare each other. Cities could compare each other. I think that's, quite an effective advocacy means and a way of also measuring the prevalence. And I think another aspect of the question, which I feel sometimes gets a little bit neglected, is that social isolation and loneliness not only has consequences for health, but it can also increase economic development and innovation through social capital. Dense social networks tend to lead to economic development and innovation. And I think that argument has to be deployed a little bit more, because I think that appeals to different constituencies. And as Kripa said, it really is important to make the economic case. I think that's absolutely vital. And at the moment, I don't think we've made it convincingly. We don't really have the data, and what data we haven't put it all together to make a really persuasive economic case. And that's probably one of the priorities.
I feel like what I was thinking about has already been said, but really just around at the state level data, the data's not there. It's hard for states to understand truly what the challenges are, or even understand the problem without having that data. So one thing we've often talked about in some of our advisory groups with state leaders is trying to develop those academic partnerships, like between academic partners and government leaders, to be able to better understand the problem, better understand how do we address that. But yeah, just having more data in general is a great way to be able to start thinking about this problem and how to solve it.
Interesting. Well, thank you to each of you. And a reminder to everyone joining in, feel free to leave questions in the chat, or you can DM them directly to Eddie, and we'll get to those in a moment. But before we do so, I have one more question for each of you, which is that we started this conversation off with a poll about whether people think we should appoint a designated role. And I'm curious, from your perspectives, and the different ways that you're coming to this conversation, do you think the US, for example, or other countries should follow this trend and appoint ministers of loneliness or equivalent roles, or should that be seen at the local level, perhaps, a city role that's dedicated to social connection? What are your thoughts on that kind of approach to governments addressing this issue?
Should I start? Yeah. I think it's a good idea. I think other, countries, states couldn't follow suit. But I guess I have two comments on it. One is that there are other options too. You can have national level task force, state level task force, you can have commissions, you can have all kinds of other entities that draw attention to it and kind of mobilize resources. You can have social isolation and loneliness czar instead of a minister, et cetera. So there are other options. I have one slight reservation, is I have a feeling that maybe for a number of different reasons, including the COVID pandemic and the attention it's drawn to social isolation and loneliness, that this might be a temporary fashionable phenomenon. And in a few years' time, all these ministers will disappear and the issue will kind of recede to the background. And I think it's probably more important to kind of institutionalize addressing this issue. And a minister may help doing that, but there are probably other ways that may be more effective in making sure this is actually institutionalized in governments and people come and go, topics, become fashionable and go out of fashion, but it's still being addressed regardless of that. So that would be my reservation, but I think there are a lot of pros as well.
Yeah, I mean, I think from the federal perspective, and more squarely focused on U.S. government, I mean, I think it could be amazing, like a great way to raise awareness and focus on the issue and implement like a whole of government response to the multifaceted aspects of this problem. But I do think in reality, there's an issue of the position taken seriously. And I think like just from operating within Congress, I think there should be some sort of way to build bipartisan support for the need for something like this. And I think, making sure that there's a well-defined role for a minister with clear jurisdictions and responsibilities and regulatory authority, as opposed to, just a position appointed by one administration. I think that's especially the case if the goal is for it to be a long-term position that's consistent between administrations. I think, there should certainly be thought given there, just like that practicality of it.
Yeah, I would say from the state and local level, I think a lot of the work is going to be driven by state leaders or local leaders. And so one kind of alternative to national level would be just trying to push forward and make a focus on establishing either like a point person or department within existing agencies for social isolation and loneliness. I know, whether that would be in a Department of Public Health or even Medicaid agencies or behavioral health agencies, just appointing someone who's starting to think about social isolation and loneliness would be a great place to start, maybe beginner steps here, as well as just developing task forces. I know a lot of states and local governments have done that as well. And then maybe going from there and growing it into something larger.
Wonderful. Well, thank you so much to each of you for sharing your thoughts on these questions. I am going to hand it over to Eddie to pull some questions from the audience that came up since I was not able to monitor the chat as closely.
Yeah, thanks everyone. And thank you all for all the dialogue in the chat. So there were some questions that with so many experts on the call, you all were able to chip in and answer each other's questions. That was fantastic. So for the panel, one question came in. Policymakers grapple with many issues at once with the end goal of improving the lives of societies in which we all live and operate. What obstacles and opportunities have you encountered in making the case for policymakers to take up the issues of social isolation, loneliness, and connection? So in short, from your perspective, what are the big obstacles or opportunities to advocate for these sorts of policies within your jurisdictions and your levels of government? So I'll start with you, Chris. You're on mute, Chris.
Sorry. So I'll start with the opportunities. I think one, and I'm not quite sure why, but it seems like this issue has an inherent appeal. I've worked on a number of different issues, and this just seems to, people gravitate towards it. They immediately understand why it's important. Maybe because everybody's experienced loneliness at least at some point in their lives. They know someone who's lonely. So this issue really has an inherent appeal, which makes it kind of easier to advocate for. I think of other issues I've worked on: violence against children, violence against older people. That's a pretty grim issue, and people don't want to be thinking about it too much sometimes. Well, this one doesn't seem to meet with. Okay. I think another opportunity is that half the work is done. I mean, if countries are already appointing ministers, is that the policymakers are already pretty aware of this. And in a way, we have to capitalize on this, especially with the COVID pandemic, which has drawn even more attention to it. So I think now there's probably something of a short window of opportunity to really focus on this issue. Obstacles, and some of these contradict what I said before, but I've encountered within my organization, they say, well, it's not big enough a problem to make such a big deal of. These are public health specialists, and they think it's kind of a bit of a soft problem, not really a proper health problem like, cancer, tuberculosis. And so they tend to dismiss it. And so you have to find a way of counteracting that. Again, from my perspective in a global organization, a lot of people think it's a high-income country problem. This is a problem of rich countries, you know, the UK, Japan, the US, whatever. And it's not as relevant to low and middle income countries, which is untrue because the rates seem to be just as high and the health impacts are probably the same. So it's much of a problem in other countries. It's just not high up the policy agenda. And I think one of the obstacles that a few people have mentioned to me, and which I already mentioned, is the lack of cost-effective intervention strategies, etc. And that really should be a priority.
Yeah, that was interesting. I think from my perspective, you know, the challenges that I run into, I think it's really about it appearing as a soft problem, as Chris described. Like, I remember one time I was, you know, in a meeting trying to make the case for including the senator's social isolation bill as part of the Older Americans Act reauthorization, and the staffers I was talking to said to me, you know, it's not the federal government's job to make sure people have friends. And so I was just taken aback by that, because I think, you know, with the senator's real interest here, and I think this group having such a big interest here and understanding like this is not a soft problem, I think there's just a lot more education that needs to be done with people. Not just, you know, general awareness building, but I think with policymakers too. I think we're just still on the early end of it. But I think a huge opportunity is the fact that COVID shined a light on this problem, and everyone understands what it's like to be socially isolated or to know someone who was. And I think, you know, building on that momentum will hopefully make us move more quickly as opposed to dragging our feet on this too.
Thanks, Pippa. Sarah, how about you from the state perspective? What do you see as the obstacles and the opportunities?
Sure. Honestly, I think Pippa really captured a lot of what we've been seeing at the state level as well, as just state leaders not necessarily fully understanding what social isolation and loneliness is or its impacts, as well as then just not thinking of it as a priority. So, you know, worrying about workforce development, worrying about unemployment, worrying about all of these other huge consequences of the pandemic, and just not getting quite down to the level where they're starting to care about mental health and even more specifically social isolation and loneliness. Not that it's not important, just that in their minds, traditionally, what they've been focusing on would not be that. So it's trying to make the case for state leaders to prioritize social isolation and loneliness and really understand that it's really at the same level in terms of impact as some of these other policy areas. But I would say, like Kripa as well mentioned, is just this is the first time, well, perhaps I shouldn't say the first time, but it's an opportunity where states are really starting to focus on mental health, because it's just been so apparent from the pandemic that this is something important, that it's something that really factors into constituent well-being. And so it's something that state leaders are starting to think about. So if we can make sure social isolation and loneliness is part of that mental health policy discussion, then I think that's a really great way to kind of get that conversation started and leverage it into something more.
Sarah, to your point, you know, one thing that the Foundation for Social Connection and the point of these conversations, this series, was to help us all think about how does social isolation and loneliness, social connection fit into other sectoral policies and approaches. And so from the state perspective, it might be helpful for us to be thinking about how does social connection impact workforce development? How does it impact our economies? And that's the kind of the point of these conversations. So we're hoping to be helpful in that space. I think we have time for one more question. Just very quickly, variety of the points that we've all been making here around addressing sort of the symptoms of social isolation and loneliness from a policy perspective, or sort of like crisis management. Several comments were made in the chat around how do we think about, or why, let's say, could we think about social isolation and loneliness from a more upstream and prevention standpoint, and including so through policy? Do you have any reactions or thoughts about how we might address this from a real societal level upstream before we get to the health and mental health impacts? Go ahead, Chris.
Should I go? No, I'm always one who's starting, but I think one thing we still need to do is get a better understanding of some of these upstream determinants of social isolation and loneliness. Some things are just not clear. Like, people talk about an epidemic of social isolation and loneliness. They talk as if it's increased tremendously, but if you look at the evidence, it's not clear that it has. And I just saw an interesting meta-analysis yesterday that was looking at whether it increased over the last 40 years among young adults, teenagers, and it seems to have increased in that population a little bit, but we don't quite know why. So I think we need a better understanding of some of these basic things. Has it increased? Why has it increased? Is it technology? Is it more social mobility? Is it, there are all kinds of possible factors, because we can't address these upstream factors as long as we haven't clearly identified them. And I don't think we've quite identified them. And we also don't know if it's higher among men or women. We don't actually know whether it's, which age groups are most effective. Some studies show one thing, other studies show another thing. So I think there's a lot of work to be done there before we can start addressing these underlying factors.
I'll just mention before I move on to Kripa, we'd love to hear from all of you in the chat too. What do you think? Why is loneliness and social isolation on the rise, and how do we address them in a more preventable way? Kripa, any thoughts from you?
Yeah, I just think that there are so many factors, and I think it is really important to think about it, across the age continuum too, and in the different setting. I mean, obviously, I was focusing more on the side related to seniors, because we were, had an opportunity with the Older Americans Act, and I think we have just heard time and again about, as you're trying to make the shift to help older adults, stay independent in their own communities, there could be some negative aspects related to being socially isolated. And so, like, how do you provide those resources and balance that? But, we hear a lot from, folks in schools, and, I think I'm just monitoring the chat. There's a lot of, evidence in terms of the impact of technology and social media on youth and adolescents. And, I think the connection to, more people feeling just really a lot of stress and anxiety, a lot of it is driven by being socially isolated. So it is interesting to think about what more do we need to do to understand the evidence of our upstream factors leading to social isolation, or is it the other way around? And I think, that's another opportunity, as we were talking about the data piece earlier too.
Is there any closing thoughts?
Yeah, the only thing I would add, I suppose, is just, I think there are some circumstances or cases, such as when individuals are moving into a long-term care facility, where we just know that there are going to be challenges with social isolation and loneliness. And so I think there's opportunities for states or providers or to think about how can we, before that's even happening, think about putting systems in place that would avoid putting the individual in a situation where they would have to deal with social isolation or loneliness.
Yeah, absolutely. A recurring theme here is the need for continued research to fill gaps in our knowledge base, to understand the causes, but also how we solution. And we thank you all for being a part of those dialogues with us and pushing forward policy solutions as we move forward. So thank you for joining us, and thanks again. Okay, we're going to now move into the next portion of our agenda, which is to have breakout sessions. But before we do so, just wanted to offer a few announcements before we break out. First up, our next and final conversation in the series is Connect+U. It is the last event in the series and will take place in January. We will announce the speakers soon, and in the meantime, you can use the link in the chat to sign up. That'll be coming to you now. Finally, we'd love, of course, for you all to stay involved, as always, in this dialogue and in future ones. So if today's conversation sparked an idea for you, feel free to reach out to us. If you'd like to stay connected with each other, you can join the Commit to Connect nationwide network of champions who are dedicated to ending social isolation and loneliness in the US. Or you can join the Togetherness Hub, which is a global community of people working in this space. We'll email out more on each of these later today as well. And then with that, we'll move into the small group discussions. I'll turn it back to Kathleen.
Great. So thank you again so much to our panelists. If you have to drop off now, no worries, but we really appreciate your time and sharing your expertise. It's really exciting to see all the momentum in this space. And for those of you who are able to stay for breakout rooms, we have a few prompts here to spark discussions. Of course, feel free to take the conversations in whatever way is meaningful to you, but we invite you to introduce yourself, share a little bit about what stood out to you in today's conversation, and then perhaps share with us how might government programs or legislation related to social connection support your work and the work that you are doing in your communities. So with that, we are going to break out in a moment. These are not facilitated breakouts, so take the lead, and we hope that you have an enjoyable time connecting with each other. Welcome back. I think we're just waiting for a few more people. Hey, Andy, good to see you.
Good to see you too, Kathleen. This is great. Really appreciated all of this, and it was a good breakout.
I'm so glad. Also, Davey, I appreciated seeing your baby.
Oh yeah, I was on mute. Ezra was getting hungry, so he is now with mom, getting well-deserved lunch.
He's really cute. Great. Well, we should all be back in a moment. Awesome. I see Sandra and Lena, lots of friendly faces. Kevin, hello, everyone. Welcome back. Well, we are going to use this time for open discussion. So we would love to hear from you either in the chat, or if you would like to unmute yourself and share, what did you learn today? Or what were some of the ideas that sparked for you? And what are some takeaways you'll be leaving with? It's so nice to see so many familiar faces and some new ones.
I'll just jump in real quick here, Kathleen. Something that's really popped out to me, and I might have mentioned it in the group chat earlier, is there seems to be a huge emphasis on the physical barriers and the physical elements and the physical problems because of loneliness and social isolation and disconnection. And what I'm not hearing anywhere is the emotional disconnection. You know, you can have a group of 200 seniors in a senior living community who can go downstairs even in their wheelchairs and in the elevator and be together, and they're still not connecting. They're not sharing. Why is that? Why are we so shut down? I don't think it's a mental problem. I think social isolation and loneliness can cause mental health problems, but to feel lonely, that's a feeling that anyone can have. You're not crazy, you're not mentally ill, it's a feeling. So this is really an emotional health problem, not a mental health problem. And until we start understanding or shifting the paradigm, I think we're going to really struggle to solve the problem. My 2 cents.
Thank you for sharing, Kevin. Any responses to that or other reflections on today's conversation that anyone would like to share? And feel free to add it to the chat too.
If I could jump in, I agree totally with Kevin, and there's been studies done, and I think I posted in chat earlier. There's almost half the residents are suffering from a diagnosis or symptoms of depression, and despite all living together. So what we found is that it needs to be an intentional act. You have to really actually have to program, and rather than this consumer idea where this continuous diet of entertainment and distraction, which kind of results in malnourishment of your emotional health, and people get tired of it. They don't want to go. You're lonely. You don't want to go on a bus trip with a bunch of other people that you don't know, So, and I think it even beyond the care home, it goes out into condominium living, everywhere, the consumer society. I think we have to really make an effort to work on social skills and getting people to reach out and seeing and getting the rewards, right? So we find that when we intentionally start a group where they're tasked with reaching out to other residents, especially the lonely ones, those 30% that do all the programs can reach out to the 70% that don't do any programs and make those connections, bring them into the group. And so it's about social identity within a group. Feeling part of a group is really important. Feel a sense of safety and engagement is all part of a healthy life. And so loneliness is all about fear and isolation and vulnerability. And so anyway, the side, the Kit Wood, and there's a lot of psychology behind it, but just it's not that hard to get people engaged. Thanks.
I think in a comment reflecting on both of those comments, Kevin and Clayton, is that I really appreciated, I think it was Sarah who mentioned social emotional training in schools. And I think that's really where it needs to start. We need that to be the norm, that every student from a young age is learning this is skills, right?
But that's
because
different. That's also different though, because the social and emotional training deals with social and emotional learning, right? SEL, which focuses a lot on the emotional intelligence aspect, which is our ability to understand, recognize, and manage our emotions. What I'm talking about, and I think what Clayton's talking about, is actually facilitating an emotional connection. It's emotion. I define emotional health as your ability to give and receive love, connection, and a sense of belonging. If we struggle to receive love, then we're going to struggle to connect.
Kaisley?
Robin, yeah.
Yeah, it's me too. I also think it's hugely a sense of purpose. I think that's really what, and we, in our group, we talked about the issue of belonging. It's really that sense of purpose that overrides all the other issues. Because once you have that sense of purpose, that sense of identity, that sense of giving, you really become enriched in such a way that loneliness can't seem to penetrate.
That's a great point, Robin. But then I'll also say that, like, look at the medical community. The medical community, if you become a doctor or a nurse, just to generalize for a moment, you have an incredible sense of purpose. My purpose as a physician is to save lives. But look at how many physicians are killing themselves because they feel so undervalued, disconnected in their own profession. So I agree 100% with purpose as a big wellness motivator, but I don't think it really addresses the social and emotional needs that we have.
But a sense of purpose doesn't have to be being a physician. A sense of purpose can be something like being a baby rocker in a NICU unit. It could be something very small and very tiny, but it's meaningful to that person.
Absolutely. But then how is that help? I agree 100%. You can have multiple different purposes in life, but how is that helping you connect to the people who matter most to you? If my purpose is to rock the baby, but I don't feel valued by my father, I'm going to be pretty depressed.
I want to make sure others have a chance to jump in as well. Does anyone else have some thoughts by chat or video?
I'd like to say something here, Mario Pro in Toronto. Thank you for having us here. Our little group, I think we had a consensus that we should not wait for the government to issue instructions. We should start acting on our own, and we should help the ones that feel ready to help, to be helped. Like Kevin says, not everybody's ready to receive love, but some of them probably are ready now. Let's start with them. Let's start with them and seek out what they need in terms of intervention. We don't need to decide for them what is good for them. They should tell us what they need, and we'll make it happen.
Mario, are you familiar with the Genwell project in Canada?
Yes,
Pete
I am, and I spoke to Pete a couple days ago. We are working on that.
Fantastic.
I'm reaching out to a lot of people. I'm bothering a lot of people on LinkedIn, so
You should. That's great.
Networking, it's happening, but I'm on my own here at home. But what we need is a rich person to support us, or an organization to, I would believe, a charity or a corporation that would support this kind of attitude, this approach. So myself, I'm volunteering for 2 organizations, and I'll be reaching out to older people, and I'll have a chance to find out what they want. These people are ready. If they show up in the YMCA, they're ready to do something and interact with people. So Kevin, you could join me and see what they love, how love they're ready.
Could I just add a +1? I would also like a lot of rich people to walk into my life and support our nonprofit.
I think that's a request to Casley and Eddie for the next conference call. Could you bring all the rich people together and we'll have a conversation with them?
Sounds great, everyone.
I'd love to.
Everyone, I am sorry, Peter. We do have to wrap. We have some conflicting meetings right after this. I hate to cut off the conversation. That's literally the point. But I'm just going to let Casley wrap us up.
Sure. Well, I'll just say quickly that we would love your feedback. We'll submit a survey in the chat, and we'll also email it to you later. But thank you all so much for coming and being really engaged. It's always great to hear, to see your faces and hear your perspectives on this issue. We also want to thank our partners at Commit to Connect, the AARP Foundation, and the Administration for Community Living for sponsoring this program. And thank you all. Please be in touch. If you had other thoughts that you didn't get a chance to share, feel free to email them to us, and we'll share some ideas for how we can all stay connected in an email later today. Great to see you all. Thank you.
Happy holidays, everyone.